kind of do it the way that I would expect. Let's say that Chris is me. Okay, poor guy. Chris is going to be essentially like the guy, or going to be playing my role on the practical exam. So I'm going to be kind of talking Chris through what I'm doing.
Please disregard the fire alarm.
Oh, this is great.
It never stops.
All right. So you're going to come in on the practical exam. Oh my goodness. And you're going to draw. Mom sending me days like this. You got this on videotape?
Yes, actually.
It's not really videotape though. Tatiana, my name is Gene. I'm an occupational therapist, and we're going to be doing an evaluation today. And part of this evaluation is going to be looking at your muscle strength and your motion, and making sure that we address the issues that brought you here for therapy. Okay. So the first thing I'm going to be doing is what's called muscle testing. I'm going to be assessing your muscle strength, and we use kind of a grading sheet to determine if there's weakness there and what specifically we need to do to help you with that. Okay. None of this should be painful. If there's any pain at all associated with what I do, you let me know, and we'll modify what we're doing. Any questions?
No.
Make sense?
Yes.
Okay. So the first thing we're going to do is look at your shoulder initially, and the first movement we're going to do with the shoulder is I'm going to ask you to raise your arm up, and what I want you to do with your arm is just take your hands up to shoulder level. We're going to do that with your right shoulder. Can you do that movement? All right, good. I just assessed fair muscle grade. Let it back down. Now what I want you to do is that same movement, bring it straight up in front. I want you to hold it there and don't let me push down on it. Okay? And let me know if any of this is painful to you. So hold right there and don't let me push down. Okay? And let it back down. I just assessed for normal. And now bring your arm back up to that same position, and I'm going to apply resistance as you do it. Just raise it up. Good. Let it back down. Just assess for good, moderate resistance through the range. All right. Now what I'd like you to do is I'm going to have you lay down on your left side, looking that direction, looking away from me. And let's bring your arm down to your side. And I'm going to support you, and what I want you to do is bring your arm up to that same position that we were for when you were sitting up. Okay? Go ahead and move it there. All right, bring it back. And just assess for core. And I'm going to palpate for trace muscle strength. I'm going to tell you what the muscles are, and I'm going to tell you the innervation of the muscles. Okay? All right, let's come on back up. Tatiana, please. Tatiana. Okay. Okay. Next movement we're going to do is I'm going to actually have you stand up for this, if you don't mind. And we're going to, with your right shoulder, we're going to bring your arm back. And actually, just for grins, we're going to do your left shoulder because they're taping this. I hope you're okay with that. You're going to be famous. Your left arm, we're going to bring back this direction as far as you can. All right. Bring it back to the start position. Just assess for fair muscle grade. Now I want you to do the same thing. Bring it back as far as you can and hold it there. And don't let me push you down. Okay. And hold that position. Okay, back down. And just assess for normal muscle strength. And then take it back there once again. I'm going to apply resistance as you move. All right, back down. And just assess for good muscle strength with moderate resistance. And now I'm going to have you once again lay down on your right side. And lay down this way so we can get it on camera here. You don't have to say that during the practical, get it on camera or anything. And I want you to bring your arm back towards me as far as you can. Okay, back to the start position. Just assess for core muscle grade. For trace, I'm going to palpate these muscles and tell you what the innervation is. Okay? All right, let's come on back up, please. The next movement we're going to assess is with your right shoulder. I want you to bring your arm up to where your hand's level with your shoulder. So coming up just like that. Okay, back down. And this time I'm going to have you do that same movement again and hold it there. Don't let me push you down. Hold right there. Let me push down on you. Okay, bring it back down. And just assess for normal muscle grade. Okay. Now I want you to do that same movement, and I'm going to apply resistance as you go. So go ahead and bring it up. And back down. That was assessing for good with moderate resistance. Okay, I'm breaking character here a little bit. So what you want to make sure for each of these, and just kind of keep an eye when I'm doing this, the other thing I'm looking for is how are you stabilizing and where are you applying resistance? Okay, just remember, don't cross the elbow for anything we've done so far. You stay either at the elbow or just above. You don't want to be too far up this way, or too far up this way, because then you lose your leverage. You can't really determine, is that really apply maximum resistance? So you want to be basically down as far as you can without crossing the joint. All right. Okay, Tatiana, I want to have you lay down now with your head looking up towards the ceiling. This way. And I'm going to support your arm. And what I want you to do is bring your arm out towards me, coming out this way. All right. And then bring it back in. That was assessing for core muscle grade. Did I do that okay? I'll tell you what muscles perform that for traits and the innervation of those muscles. And all right. And then while I got you laying here, I'm going to go ahead and do shoulder adduction. So I'm going to bring your arm out to the side here, and what I want you to do is perform this movement right here. And that's fine for y'all when you're doing a practical, like especially movements like this. Kind of hard to explain that to somebody, so you can kind of walk them through that movement. I have no problem with that. So I want you to duplicate that movement that I just had you do. Bring your arm up. Okay, let it back down. So that's fair muscle grade for shoulder adduction. Okay. Now I want you to do that same motion again, and then hold it there. Okay, so go and bring it back up, and hold that right there. Don't let me pull you out. Okay, that's for normal muscle grade. Let's come on back down. And now I want you to do that same motion again, and I'm going to apply resistance as you go. Okay? All right, lay it back down. That was for good muscle grade. Now let's go ahead and sit back up. And you can just stay right there in a seated position. And for poor muscle grade, try and bring your hand across your body. Okay, bring it back out. That was assessing for poor muscle grade. I'll tell you what muscles do that and the innervation of those muscles. Okay, go ahead and stand up for just a second. And again, for horizontal abduction, a lot of times it's easier to demonstrate that to a patient rather than, because what I don't want to do is put the patient in that position and then say, okay, now I want you to do that because it's tough to do. So I'm just going to show you what I want you to do next, okay? You're going to lay down in this position right here, and I want you to bring your arm up just like that, okay? Don't let your face get all mushed. And on this one, just make sure that, unfortunately, I have a very helpful patient because she pretty much already assumed the position. You want your patient over pretty close to the edge of the mat because where they want to come up, the textbook kind of shows the start position, I think, out here, but in actuality, you want them going through the movement. So you want as much of the shoulder over the edge of the mat without running the risk of the patient falling over on you. Now I want you to bring your arm up just like so. Okay, let it back down. And then go ahead and do that movement. Again, I want you to hold it right there and don't let me push you down. Okay? All right, let it back down. You okay? All right. You comfortable? Yeah. So that's testing for good, that was for the break test for normal muscle grade. Now try and bring it back up again. Down. That was moderate resistance testing for good muscle strength. And then, obviously, for poor, for the sake of time, I'm not going to have her stand back up because the next movement I'm going to do, I want her right there. But for poor muscle grade, she would just do that, correct? In a standing position or seated position, coming back that way. And for trace, I'll tell you what muscles and what the innervation of those muscles are. All right. So, Tatiana, what I want you to do now is I'm going to back you over that way just a little bit so you've got more of your body on the mat. And we're going to look at your ability to rotate your shoulders. So I'm going to be asking you to do this movement right here. Okay, bringing your hand up towards the ceiling. Okay? So I'm doing internal rotation of the shoulder right now. Okay? So go ahead and bring your hand up towards me. Okay? Then let it back down. Then I want you to do that same movement again and then hold it right there. Don't let me push you down. So bring it back towards me and then keep it right there and don't let me push down on you. All right, and let it back down. So that's for normal muscle strength with the break test. On there, now try and bring your hand up back towards me again. All right, so is tested for good with moderate resistance through the range. Okay, then let's go ahead and sit back up. Remember, with internal rotation, external rotation, that's when you actually are applying resistance on the forearm. It's kind of the difference with all the other movements we've done so far where you don't want to cross the elbow. For rotation, you have to get the resistance in the right spot. And let me have you come sit on the edge of the mat right here, please. And I want you to bring your elbow at your side, and then try and bring your hand in towards your stomach. Okay. Internal rotation, core muscle grade, full active range of motion, gravity eliminated. Okay. For trace, muscles, innervation. All right. The next movement we're going to do is I'm going to have your arm in this position right here, and we're going to bring your hand back this way. Okay. So bring your arm out like so, and bring your hand back towards me. All right. Then let it back down. And